Hi, and welcome to Fairview Range Focus. I'm David Hall. Today we're joined by three individuals from Fairview Range. Aubray Pontinen, excuse me, so close. Kimberly Gustafson and Michelle Engbretson. So welcome, thank you for joining us. We're going to talk about Pediatric Rehab Services today. And so we're excited to do that. I know that's a new program that has started at Fairview. So maybe that's a good place to start. And maybe you can tell us when this is a new program that started. When did it start? Can somebody help me with that? Help us understand when that started.
Well, we've had speech therapy there for a while,
Okay.
seeing pediatric clients. And then we started about a year and a half ago with occupational therapy. And then Kim came about 6 months ago, and so then we added physical therapy. So then we have all three disciplines there now.
Okay.
So
And all three disciplines specifically treating pediatric patients.
exactly.
Okay.
Yep.
Okay. All right. Very good. So Kim,
Yeah.
tell us about the pediatric physical therapy and what types of conditions you treat and what maybe types of modalities that are utilized.
Yeah. So I see pretty much everything under the sun, from just a couple months old all the way up through middle school and high school. Conditions that children are born with, like Down syndrome or CP. Other things like if they have sports injuries or if they just have difficulty moving in general. I do my own assessment of watching how they move and seeing how that matches up with maybe some of the things that you would expect from other children growing up around that age. And then based on that evaluation, we kind of work on those tasks in a play format. Mine's kind of the fun one. I get to do a lot of fun in games.
So help us understand when you say play format. What
Yeah.
exactly does that mean? What does that look like?
Pediatric therapy is different than adult therapy. If I was going to work on an exercise with you, I'd say, okay, let's raise your leg 10 times. If you ask a kid to do that, they're probably already running around in circles anyways.
Okay.
So being creative and coming up with a specific focus. If I want to work this muscle group, how can I best do that in maybe a game format or something to engage the kids a little bit more?
Okay.
So a lot
So it
of
sounds
creativity.
like a lot more fun than just saying raise your legs 10 times.
It is a heck of a lot more fun.
Okay.
Maybe I should try that with the adults.
Yeah, it might be fun. It might be fun.
Yeah.
Okay. And tell me about the age groups. Is there a certain limit when they're no longer appropriate for a pediatric program?
It gets to a certain point where maybe they transition to more of the adult outpatient therapy, but so far, youngest I've seen is 2-3 months, all the way up to, like I said, high school. And depending on, what type of needs they have and what type of condition we're treating, figuring out where they fit best in the spectrum, which that's nice because at Fairview Range, again, we've got the pediatric and outpatient, so we can keep them all in one area.
Right.
So.
And you have a specific area for the pediatric program, is that right? Or is it all in the same area?
It's all in the same rehab area, but
Okay.
we're in the process of expanding our pediatric area to include a brand new PT gym. I believe there's 3 different treatment rooms, all specifically designed for meeting the needs of the kids.
Okay.
A lot of the big heavy equipment we have in the other gym areas definitely wouldn't work for some little ones.
It does sound like it'd be a lot of fun. I mean, working with kids, like you said, a play format and everything, so.
Yeah,
Okay.
yep. There's going to be, already have a lot of really cool things that we use on a day-to-day basis, a rock wall, a climbing ladder, we've got slides, trikes, and again, a lot of it sounds like just fun and games, but it's very specific reasons why we use things, and
Right.
that's part of the creativity that goes into what we do.
Right. And I'm sure, I'm assuming that that's probably really a motivational tool for the kids versus just telling them we want you to bend your knee or do something versus saying climb this wall.
Right. For some reason, everybody gets the impression that PT is the pain and torture. But we go out to get our kids in the waiting room, and they can barely wait to grab our hands and run back.
Oh,
so
fun. Oh, neat.
We have a good time.
Okay, good.
Yeah.
Thanks. So, Michelle, you're an occupational therapist.
Yes.
And so tell us a little bit about that and how did that interplay with pediatrics?
Well, a child's occupation is play. Children learn through playing. They learn how to move their body and do the things that they need to do. They learn to dress themselves. They all the things that they do every day that we learn, and they learn that through play, the imaginative play that they need to have to learn and explore. So that's where occupational therapy comes in with a child. That is their occupation, is play. So we design a lot, just like in physical therapy, a lot of the interventions and sessions are play. The children think that it's play, and it looks like play, and it is play, but there's a specific reason that we're doing the things that we're doing to get what we want. So
you mentioned, just the term occupational, and you said that for children, their occupation is play.
Right.
I'm curious, sometimes I think some people get confused by that, to hear occupational therapy and think, well, it must be something job related.
Right. Occupations are all the things that occupy your time every day. Okay. Your activities of daily living would be like dressing yourself, showering yourself. Your instrumental activities of daily living, which would include shopping, cooking, cleaning, laundry, all of those things. If you have a cognitive deficit or a physical deficit that doesn't allow you to be able to carry out those things, that's where occupational therapy comes in to work with in those areas. It also involves your sleep, your job, school. So it's really all the things that occupy your time, and that's why it doesn't have the best name. I don't know who named it a long time ago, but people get a little confused sometimes.
Sure. Well, that's a great way to describe it, though, to say what occupies your time.
Yes.
So thanks for clarifying that. That's kind of a neat way to look at it. Oh, that's good. So is there particular conditions that you think of from a pediatric standpoint that you see more patients pediatric-wise?
I see children, again, as young as 18 months to 10 years old is kind of the spectrum of what I'm seeing right now, age-wise. Different conditions, again, things that children are born with, such as Down syndrome or CP, but then things that happen as children are growing up developmentally, if they're not meeting their developmental milestones. When you go to the doctor, they'll say at this age they should be doing this or that, and if they're not meeting those, a lot of times the doctor will suggest occupational therapy. Well, let's see if there's something that we can do to work with their fine motor, or their self-care, or their self-regulation, and just their ability to interact in the environment through their sensory processing.
Okay.
Yeah.
And I heard you said something about imagination.
Yes.
So tell me about that. How does the imagination for a child enter into that?
Well, if you think about a small child sitting down and they play with toys, they'll pick things up and they'll take a cup and they'll pretend like they're drinking. They get that movement in there. Oh, well, that's going to help them to be able to feed themselves and drink. They'll be playing with toys. They might arrange their toys and do like a sharing, like a tea party that kids would do. Well, that's a social interaction that a child develops. Just exploring and having that imaginative play is what's going to help a child to develop and meet those milestones too that they need. So
good, neat.
Yeah,
sounds like a lot
fun.
of fun too.
It is fun.
Yeah, good. Okay, Aubray. So speech therapist. So tell us a little bit about that and how what role you play.
Yeah. So working with pediatrics, we work with kids of all ages, so birth through the grade schools.
Okay.
And any kid who has difficulty communicating their needs and their wants and their ideas. Also, a child who has difficulty participating in conversation, understanding conversation, answering questions, kind of items like that. Also, we work with kids who have difficulty producing sounds. So their articulation, their ability to produce the sounds is just they have a difficulty with.
Yeah.
So it can be play based or kind of table, more structured. But you need to really definitely keep those little ones motivated to work. So we get creative.
Okay. I bet that's a challenge at times.
Yes, it can be. It can be.
Okay.
Yeah, but it's also it's a lot of fun.
So is it? Are there situations where you may have a pediatric patient that is seen by all three of you at some point? So
Yeah, definitely. There's a lot of kids that we see, they are developmentally delayed, so meaning they have a delay in more than one area.
Okay.
So I can be seeing a child who is unable to communicate their needs. Michelle would see them to, work on their fine motor, and definitely Kim can be also seeing them
Okay.
as well.
Okay. And from a speech therapy standpoint, are there particular exercises or activities? Can you kind of give us an example, some things you might be doing with a child?
Yeah, so the best thing to do with your child is to actually sit and play with them. Sit on the floor and play with them. And kids learn so much through play. You can learn, your basic concepts such as going up, 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 up. So you're working those basic concepts, and then as well as your speech sounds. So listening to a parent read to them or play with them, that's really a big thing for kids. In therapy, our exercises, depending on what we're working on. So if we're working on the S sound or the SH sound, we call it drill and kill. So we drill that sound over and over and over in single words or in sentences, and we try to get that child to produce that sound as many times as possible. And the same goes with, concepts, basic concepts, understanding different language.
Okay.
Yeah.
I've often heard this, I think, both raising my own children and now looking at grandchildren, where there's sometimes a question about wondering if their speech is developing properly or in the right time frame. Is there any indication as a parent that you have to say, well, gee, maybe they should be seeing that they don't seem to be developing like we would expect them to? Is there any indications that you can help us with?
Definitely, you can talk to your doctor during your child follow-up sessions, and asking your doctor, pediatrician, by age. So our rule of thumb is at age 2, you want to be able to understand a child 50% of what they say.
Oh, okay.
By age 3, it's 75%, and age 4, it's about 100%. So it's kind of just a a guideline that we do. Obviously, there's more to that, but
Sure.
yeah. So
But that's kind of a useful guideline, for people to know.
definitely, yeah. So it's easy to use. Yeah.
Good. How about frequency, as far as the patients that you see? And I'm sure there's no consistent or guideline or set rule per se, but on average, would you get, how often do you see a patient?
It depends on the patient. So some kids I'll see mostly it's 2 times a week for about a half an hour. With kids, we see the less time that you see them because so 30 minutes versus an hour. For some little kids, it's really hard to maintain focus.
Sure.
So for that entire hour. However, with some kids, they need that hour in order to, get the most out of their therapy. And it really depends on, the patient.
Okay.
So
it's really individualized for
It
each
really is.
one, sure.
yeah,
Okay.
yeah.
Kim,
Yeah.
from a referral standpoint, what's necessary? I mean, if someone was listening to our program and saying, gee, I wonder maybe if my son or daughter should be evaluated, or, what do they do?
Yep. First step, I would talk to your pediatrician, as Aubray mentioned at the well child exams, especially if you have parental senses. If something just doesn't seem quite right, ask about it and get it checked out. And pediatricians up here have been great about putting in the referrals, and then they just call Fairview Range Rehab and schedule an appointment. And our staff at the front will help get you seen to the right people. So,
Okay.
yeah.
Or their primary care physician, too, if they don't have a pediatrician.
Correct.
So,
Yep.
Okay.
Yep.
All right, good. Michelle, I'm wondering about physicians or
Okay.
primary care. After you're seeing a patient, how is the physicians involved, going forward in their care?
Well, usually what we'll do is we'll reevaluate. We do a progress note every 90 days to just, are we meeting our goals? Where are they at on their goals? And those go into their permanent record, their medical record, and the doctors are able to review that and see where they're at. And, you know, I'm assuming they go in once a year, you know, for their regular child checkups. And then at that point in time, too, speaking with your primary doctor, where are we at? How are things going? But we can contact the physicians at any time if we have concerns, and they can contact us if they have concerns as well. So, you know, we're just a phone call away.
Yeah, so it sounds like it's a pretty close connection.
Right, yep.
Just to piggyback on that a little bit, it's really very collaborative between us and the physicians and the teachers at school and the parents. Again, it's kind of all of a group effort to make sure that we're all on the same page and making sure that these children are, you know, meeting each step along the way. So it ends up being quite collaborative, actually.
So tell me about the teachers. How is the school system involved, or how does that, you know, enter into this?
If certain children come in, some of them have individualized education plans, and sometimes we have a role in that, in the way that we evaluate and treat the kids. So making sure that if Michelle is noticing that they're having a hard time with their handwriting, maybe it would be having a conversation with the teacher too if there was something that they noticed about the handwriting as she's working on that specific task. Making sure that if there's a task, you know, that I'm working hard with on a child, if you know, at recess, for instance, if they're going to go out and play and run, getting maybe a little bit of feedback just about their performance, so I better know how well what we're doing in therapy is carrying forward in what they're doing in daily life.
Okay.
Yeah.
That sounds neat. How about parents? Are parents involved, Aubray? I mean, in the actual, other than transporting, obviously bringing the kids in and stuff, are they involved at all in the therapy?
Yeah, parents are a huge part of therapy. So as therapists, we only see the child, you know, if it's twice a week for 30 minutes, and the parents are with them the rest of the time. So it's really important that sometimes, you know, we give homework to do at home. So home program, we give them tips and ideas, and it's really just kind of that open communication. So when they have questions, you know, if they have concerns about something that their child's doing at home, they can bring it in and we can give them tips, and vice versa. So it's really just that open communication.
Okay. Yeah. So you said homework. So is this something the parents that are working with the kids with at home that are related to the therapies?
Yes,
okay.
Definitely.
Okay.
Yeah, so in order to carry over the skills that they're learning in therapy, it's important for them to do the skills at home and across different environments with different people, so they're able to do these skills, you know, in everyday life.
Okay.
Yeah.
So how important is it for families to be involved in the outcomes? I mean, is it something you look at as, you know, really a critical thing, or do you see that really playing a big role?
I think that family really needs to be involved. You know, they are there when we do the initial evaluation and we get feedback from them, what sort of goals they want their child to reach, because that's really important. And then at times they will bring them into a session to educate them and show them, you know, this is what we're doing, and you know, that's kind of individual. Sometimes it's better to have parents not in the session, because then the children will interact with us better and not be looking for the parents as much. And then there are times when you want to draw the parents in and really educate them and show them how we're doing a certain task so that they are carrying the same thing out at home. Because it is really important. Like Aubray said, we only see them for maybe a half an hour, 2 times a week. All that other time that they need to be working on things to help them get ahead and reach those goals.
That makes a lot of sense.
So, yeah.
Good, thanks.
Yeah.
Kim, I can tell you're all very proud of what you do, as you should be. When you look at your program, is there something you kind of feel you're really particularly proud of, or feel like it kind of sets you apart from other programs at all?
I would say what's really nice is that we have, again, all 3 disciplines. So when a family brings a child in for care, you have multiple sets of eyes there. And we talk with each other all the time of, I'm seeing this and maybe one of my patients, would this be worth taking a look at? So I think one of the strengths of our program is knowing that if your child comes to our program, there's a number of us that are working on, again, the common goal of just giving your child the best experience, growing up in their life as they can, and that we're all there to help. So I think the combination of our teamwork and then just knowing that we're all supportive in every patient that we have, it's probably one of our biggest strengths.
Oh, that sounds like a great one. Thank you. That's good. Aubray, I think you mentioned something about it as far as working together and that you might recognize something when you're working with a patient. So is that something where you find yourself, going and maybe talking to Michelle or Kim and talking about a child that you're seeing? And
Yeah, definitely. I'm going to have to agree with Kim that's why I love kind of where I work, because I do have, my colleagues there to bounce ideas and kind of ask them questions. If I see a child doing, this, should parents be concerned, and do they need to come to see you? Reading or, making referral to another discipline. It's really big.
Okay.
Yeah.
Neat. That's very neat. You each represent 3 distinct disciplines or professions. From a certification standpoint or advanced training, is there advanced training in pediatric therapies that you're involved in? Kim?
There is in physical therapy. You can get your specialist certification in pediatrics.
Okay.
And there's a number of different fields within physical therapy, but specifically for pediatrics, there's kind of a general pediatric specialization. Then there's also for specific treatments, different things with sensory, different things with development of gait. So part of our requirements as physical therapists is a lot of continuing education hours every 2 years. So finding those interesting courses and then taking what I learned and jumping right back in with my patients.
Okay.
Yeah.
Michelle?
So again, the continuing education, we all have certain amounts of continuing education hours that we have to fulfill every 2 years to keep our license, and it's been nice to be able to have that in pediatrics. Now, as we started doing this, I've attended a couple of different courses, which have been really helpful to me, specifically for pediatrics. So there's a lot out there. There's a lot of different things that you can get trained in specifically. It's kind of hard to find some of them in the area.
Sure.
You might have to travel, but they're out there, and you can do a lot of things online, and you can get a CD course and that sort of thing, and then you test at the end and send the test in that you've met the requirements.
Okay.
So,
Okay.
yeah.
Aubrey, is that same thing for speech therapy?
Yeah, same exact thing. Yeah, so throughout school you work with all ages, but we speech therapists, we tend to work more with kids. There's a lot of kids that we work with, and then continuing education. Currently, I'm trying to start a pediatric feeding program. So that's one thing that I'm working on right now that Hibbing will soon have.
Good.
Yeah.
Good. We talk about therapy and exercises and activities, but I know that education plays a big part. In particular, I'm thinking of education of the parents and helping them understand. Michelle, can you speak to that? Would you find that to be true? Is that that you do a lot of educating?
I think we do a lot of educating. I often hear parents will say, "Oh, I didn't realize that," or I wouldn't have thought of that. So just kind of opening their eyes to what the child should be doing and where they should be at and how they can help them. That's really rewarding. I like that part of it. When you go up and you tell them and they come back and they say, "We did this at home and they were so good and they were able to do this or that, whatever we were working on." And so education is really big. You don't realize unless someone kind of tells you, "Oh, I didn't realize that they should be able to do that already," or "I didn't think about working on buttoning," or things like that they need to use both their hands to do these things, and they, when they're drawing, they're switching hands. Well, how can we get them to just use one hand when they're writing or drawing? So it's education is a big part of it, and I think that's what I like, is when parents get that, I didn't think of that. So
Kim, you're nodding your head. Would you agree with that?
Oh yeah,
Education?
absolutely. Because if, in a big part, since we do play, it's structured around play.
Yeah.
It's, well, okay, so why are you having her walk up and down the ramp that many times, or why are you having her climb, and trying to make that link between, this is what we're seeing and this is what we're trying to work on, and these muscles, and sometimes you go into a lot of depth, sometimes the bare minimum is enough, but making that connection of this is why this is important to focus on, and once that kind of clicks in everybody's minds too, again, it just helps so that everybody's on the same page. Because if I send a child home to do an exercise with their parents, and the parents don't know why they're doing it, and the kid doesn't exactly know why they're doing it, then likely it may not get done.
Right.
So then things won't really change.
Sure. Okay. Makes sense.
Yeah.
Aubrey, help us understand it. What might a family expect on their first visit? What happens?
Yeah, so our first visit, it's our evaluation. So if you were to come to see me, I would really just kind of get to know the family, building rapport with the child, and then kind of seeing what I can help the family with. What areas the child strides in, so their strengths, their weaknesses, the areas that we'll have to work on. And it's really just kind of the goal planning. So figuring out, okay, what do we need to work on? And then, it's really a lot of education too. This is where your child should be at. And then these are some things that you can do at home. So it's kind of just the initial kind of welcome to therapy.
Yeah. Good. Sounds like a real kind of introduction of sorts, laying the groundwork for ongoing therapy, maybe.
Yeah, definitely.
Okay.
And then we also we get some children who are typical and they don't need therapy. So then just that reaffirming the parents, this is where your child should be, and hey, your child doesn't need to come. They're within normal limits, which is great. So.
Well, neat. Unfortunately, we're about out of time. Went by really quick.
Yeah.
It was really fun to talk to all three of you. I know that everyone at Fairview is very proud of the program that you've established and the work that you do, and it sounds very rewarding. It sounds really as fun as you've all mentioned as well.
Yeah.
So that's great. So I know you're all busy, and I really appreciate you coming down and spending some time talking about it. And I know our community is much better off having a program like this available, so that's great to have. So thanks for
you.
joining me today.
Thank
Thank you.
So that's our show for today. Thanks again, my thanks to Michelle and Kim and Aubray for joining us. It was fun to talk about Pediatric Rehab Services. So thank you for watching, and stay tuned next month for another Fairview Range Focus. Thanks.
Hibbing Public Access Television would like to thank U.S. Bank for providing us with studio space.